More and more people are looking at dental implants as the best option for replacing their missing teeth. Patients who have had dental implant surgical care by an oral and facial surgeon relate that the final result is like having their natural teeth. Receiving dental implant care involves oral facial surgery, and obviously surgery should be performed by a surgical specialist. In this case, an oral and facial surgeon who has the training and experience to provide you with the best possible surgical result. A dental implant is composed of three parts: a titanium implant that's put in by the oral and facial surgeon, which actually fuses with the jawbone. Second, the abutment, which fits over the portion of the implant that protrudes from the gum line. And finally, the crown, which is created by a restorative dentist. Oral and facial surgeons are the surgical specialists who are the experts in surgical implant placement. Why would you trust your dental implants to anyone else?
My name is Ying.
My name is Gordon.
My name is Michelle. I went through the typical phases of orthodontia. I had braces for a long time. I was told by my dentist that I had missing permanent teeth.
I went to my dentist and he saw that this tooth was kind of misplaced. It was sticking out a lot, like the tooth was gonna go. He sent me to an oral surgeon pretty much right away.
I could feel like this pain going all the way along the side of my mouth. I couldn't even eat on the side of my mouth. So I went to the dentist and he told me that there had been decay and an infection in my jaw.
And I would feel sort of held back by my smile and that people were judging me for the way that my teeth looked.
And I would go up to a receptionist or something and talk to her, and then you could kind of see them kind of do a double take, and then I was like, oh yeah, I better cover up my tooth.
Basically referred to me to a specialist, a maxillofacial specialist, and he said that your jaw is decayed and we have to rebuild the jaw.
I was told that this wasn't a job for an orthodontist, that I needed an oral surgeon.
I was a little bit frightened about it, didn't know what was going to happen to me. So he sat me down, he showed me some pictures of the entire process and what's going to happen. Once the jaw was rebuilt, they would drill holes into the newly rebuilt jaw or the newly formed jaw, and where they can put the implants in.
It really educated me on what she was going to be doing, what was going to be happening to my mouth.
Every single visit, he was like, this is what we did, this is how far you come along.
I felt like the process was worth the result. He knew what I really wanted for my smile.
It's the same coloring, it's the same shape, same size. It totally looks real. To someone who's thinking about getting a dental implant, I would say totally go for it.
It elevated my confidence to a level that it had never been at.
I enjoy cooking. Now I enjoy the food on both sides of my mouth.
I find that I'm smiling much more. I never knew that my cheek muscles could hurt that way because I'm constantly smiling and showing off my teeth. The oral surgeon is trained to do this.